Welcome, everyone. This is the Clinical Practices Tract, and this session will be covering cultural safety and anti-racism in Denendeh, Northwest Territories Health and Social Services System, and your presenter on the matter will be Karen Hall. I'm just going to go a little bit over about Ms. Karen Hall. She is a member of the Deline First Nation and grew up in Sambakye, Yellowknife, Denendeh, Northwest Territories, Canada. She currently works as Manager, Cultural Safety and Anti-Racism for the Government of the Northwest Territories, Department of Health and Social Services, or DHSS, in subarctic Canada, where she provides leadership for a system-wide approach to cultural safety and anti-racism. Karen holds a Bachelor's of Science in Health Promotion from Dalhousie University and a master's degree, MA, in Studies in Policy and Practice from the University of Victoria, where she focused her studies on Indigenous health inequities, Indigenous ways of knowing, and cultural safety. Karen is an alumni of the Jane Glasgow Northern Fellowship and participated in the International Visitor Leadership Program through the U.S. government with a focus on Indigenous health. In 2018, she co-authored a chapter in the book, Indigenous Research, Theories, Practices, and Relationships. And recently, Karen was a part of a team awarded for the development of Living Well Together, Indigenous Cultural Awareness and Sensitivity Training for Government Employees. Thank you for joining us, Ms. Hall. And with that, I would think we'll get started.
Good morning. In my language, we say nakale, and my elder always tells me, when you say nakale, you have to say nakale back. Nakale, masi. Masi means thank you. Thank you so much for inviting me to present, especially to Stephen. I presented a variation of this presentation to one of his PhD classes. Was that a year ago or 2 years ago? Okay. At the University of North Dakota. And so this is why I'm here. I come from Northern Canada, and I'm really excited to present and talk about my work. Next slide, please. I also only finished my presentation late last night, so I do have some speaking notes here. So I'll probably sort of sit down and read some of my notes and stand up. As Indigenous people, we like to talk about who we are in terms of our family. And so a practice that we do up home in the Northwest Territories is to introduce ourselves through our family. So on my mother's side, my grandparents were Eliza and Joe Blondin up in the corner here. They were very traditional people, lived off the land, traveled by dog team. I never got a chance to meet my grandfather. He passed before I was born. However, I often meet folks who knew my grandfather in my travels up in the Northwest Territories who tell me amazing stories about him. I also learned a story about my grandmother that one day she was chopping wood when a grizzly bear came into camp, and she actually killed the grizzly bear with her axe. So really, traditional people off the land, right? So my father's side are white settlers. They're there over there, Joe and Hazel Hall. So I come from a mixed bag of Indigenous and non-Indigenous lineage. There's my mother with me. She's also a traditional person. She's a well-known healer in the North. And this is at my master's graduation ceremony a couple of years ago. I have one baby. He's 15 and a half. His name is Naze, which means hunter, and really is sort of the inspiration for why I do my work. Next slide, please. So just a bit of outline for this presentation. This picture is of my son looking out at Back Bay. This is in, I think, maybe February or March. We have a bunch of houseboats that live on basically throughout the year on the water. Lots of lakes up in the Northwest Territories. So I'll give you a background. I'll talk a little bit about the theory and the application, what we do at my work, as well. Dive a little bit deeper into the cultural safety and anti-racism training that we provide, and then some lessons learned. Next slide, please. Okay, so background, just in terms of where I'm from, the Northwest Territories is one territory in Canada, and it's in the purple right over here. Where my family comes is around Great Bear Lake, so right up here. And Yellowknife is where I live and work. The population of the whole Northwest Territories is about 44,520 people. The Indigenous peoples there comprise of around half of the population. And the Indigenous peoples are further broken down into First Nations, also known as Denendeh, Inuit or Inuvialuit, and Métis. There are 33 rural and remote communities across the Northwest Territories with 11 official languages, 9 which are Indigenous. Make sure I'm not forgetting anything. And feel free to ask questions throughout the presentation. I'm fine with that. Okay, next slide. So I work for the NWT Health and Social Services System. It is a government operated system. And I work in the department, which sets the strategic direction for the system through development of legislation, policy, and standards. There are 3 health and social services authorities as part of the system that delivers the services to patients and clients across the NWT. There are approximately 2,100 staff within both of the department and authorities. And then just a little note here, in terms of Indigenous staff employed, so remember it's 50% Indigenous people who live in the Northwest Territories. At the department, there are 21% Indigenous staff employed, 23% are at the senior management level. For one authority, I didn't have the numbers for the other 2 authorities. So the main big authority, there are 22 Indigenous employees and 8% of Indigenous employees are working in senior management. Okay, next slide, please. So to just ground ourselves in the work that I do in the issue statement, I pulled this blurb from the Cultural Safety Action Plan, which directs our work. So despite some efforts to improve the quality and accessibility of programs and services, Indigenous peoples in the NWT experience significant health disparities compared to non-Indigenous residents, so much like Canada and the US. Health disparities are complicated or made worse when Indigenous peoples do not access care because of barriers like systemic racism. Next slide, please. So back in 2020, myself and 2 other Indigenous colleagues were tasked with conceptualizing a new division to address Indigenous health disparities. And so up until that point, each of us were doing various work with Indigenous health files, and we took a few months to map out what this new division could look like, and we reimagined it as community, culture, and innovation. And so our mandate is to improve health outcomes and reduce disparities between Indigenous and non-Indigenous residents. And these are the 4 priority areas, all of which are led by Indigenous women. So we have primary healthcare reform, poverty actions, cultural safety and anti-racism, and social determinants, innovation, and public participation. And so the work that I'm leading, of course, is the cultural safety and anti-racism work, and the topic of this presentation. Next slide, please. So the Cultural Safety and Anti-Racism Unit leads the Health and Social Services system efforts to tackle systemic racism with a focus on anti-Indigenous racism through system-wide organizational culture change, improvement, and innovation. Next slide, please. And okay, so a bit of the theory and application. So the cultural safety and anti-racism work are strategies to address Indigenous health inequities that result from that interplay of colonization, racism, and discrimination within health and social services. So we define cultural safety as an outcome where Indigenous peoples feel safe and respected, free of racism and discrimination when accessing health and social services. It's important to acknowledge that the term cultural safety is a Maori concept. It comes out of New Zealand, and also a concept used to address inequities within health and social services. And a lot of other settler countries like Canada and Australia have adopted cultural safety in their work. And so you'll see a lot of that research and literature coming out of these countries, including obviously New Zealand. We also define anti-racism as ongoing action to identify, address, and prevent racism in all of its forms. So we use, it's the anti-racism work that helps us to get to the goal or the outcome of cultural safety. And anti-racism is something that we recently added to our terminology because we often would get folks or staff really confused over the term that cultural safety is all about adding culture into the institution, which it is, but we also need to clarify that our goal is to address systemic racism. So we've added that anti-racism language to cultural safety. And really the anti-racism work is so heavy, like we draw so much on the literature coming out of the US. It's something that I'm seeing more and more coming up in Canada. Next slide, please. So to work towards this outcome of cultural safety, the research and the literature tell us these enablers have to be in place. And so the first tenet of cultural safety, which is all in the literature, talks about how it's the Indigenous client that determines whether their care has been culturally safe or not. So it's really that power shift where the client has that power to determine that, not the service provider or the system. Commitment from leadership is paramount. I'll show a slide coming up, I think, about our journey, our cultural safety journey. And the one consistent thing that we've had since 2013 has been minister and our deputy minister support over the years. And that support is crucial because it allows us to do the hard work, to use the hard language, to use white supremacy, white privilege, white fragility, those types of things to enable us to talk about these things that are so hard to talk about. A system-wide approach means that this is not a sort of just a training program. We're looking at embedding this notion throughout the whole system, from policies to practices. Of course, a diverse workforce that reflects the population that it serves. So if we have 50% Indigenous people in the NWT, Northwest Territories, then we expect to see at least 50% Indigenous people working within our institutions. Staff learning and development really just means training and opportunities for ongoing learning around cultural safety and anti-racism. And then Indigenous cultures and worldviews are also incorporated and reflected within our services. Next slide, please. So here's our journey, starting in 2013. All the way to now. So in 2013, the Indigenous Health and Community Wellness Division was established with the same mandate to improve Indigenous health disparities. And at that time, it was just me. There was one position dedicated to examining cultural safety. So really up until that point, there was no sort of mandate or work done around cultural safety and how do we embed that within the system. In 2016, we released a document called Building a Culturally Respectful Health and Social Services System. And this document basically went over what the terminology is around cultural safety. Like there's a continuum from cultural awareness to cultural sensitivity, to cultural competency, to safety, and so on. As well as the work that we had done around this area in the past and our commitments moving forward. And the one commitment that we made, the big commitment that we made in that document was to release an action plan to further embed cultural safety. In 2018, we established an Indigenous advisory body comprised of Indigenous government representatives. In the Northwest Territories, we have Indigenous governments. Some of them are self-governing nations. So we bring them together 4 times a year where they advise the colonial, NWT health and social services system on ways to embed or infuse Indigenous knowledge and cultural safety. We started piloting cultural safety training in 2018, and we had 13 sessions between 2018 and 2020 to sort of test out what our approach would be like for delivering training. And then in 2019, we released the action plan, which was informed by community meetings and workshops over 10 months. In 2021, this is when myself and my colleagues reorged the Indigenous Health and Community Wellness Division to Community Culture and Innovation. And that's when the unit that I am leading was established. And we also rolled out the final cultural safety and anti-racism training model to all staff. And so in 2022, where we stand now is I have a team of 6 and soon to be 9. So we've moved from 1 position to a whole unit and soon to be a team of 9. Very proud of that. And we're all Indigenous too. Next slide, please. So our work in cultural safety and anti-racism is organized under 4 objectives. And these come from the action plan. So the first one is create an organizational culture of cultural safety. And I'll get into these into the next slides. Strengthen staff capacity for cultural safety, honor Indigenous knowledge and wellness and care, and improve client and community experience. Next slide, please. Okay, so this is a bit more of a deeper dive breakdown of each of those objectives and some of the examples of the work that we're doing. So the purpose of this first objective is to lead and support a system-wide shift to actively address systemic racism through culture change, improvement, and innovation at leadership, policy, and practice levels. The function is to establish a foundation, including processes for widespread cultural safety and anti-racism uptake and change across the system. So some of the actions in this area of work include applying a cultural safety and anti-racism lens to policies, frameworks, and strategic plans. We often get requests from across the whole system to review various documents. And one thing that really sticks out to us is how folks just don't really have a lot of knowledge around whether you capitalize I or are you acknowledging colonialism and racism in the system. So we bring that lens to the work across the system as a team. Supportive peer networks for Indigenous staff. So we really are concerned about, elevating Indigenous staff, ensuring they have a support network, because often there might be one Indigenous staff working within one unit. And there's a lot of stuff happening there, obviously racism. And so we really want to support our staff to stay with us and recruit Indigenous staff. We're just in the beginning of that work, but looking at how can we bring Indigenous staff together to also inform some of the changes that we need to make. So we are more than a health system. We also are responsible for child and family services. So this is a priority area. And we recently hired a senior advisor, culturally safe child and family services position. So this position is funded from a different division, but is purposefully located within our team because she is Indigenous. We are an Indigenous team. So we really want to make sure that she has that support and is grounded in the cultural safety work that we're doing as a team. So she just started maybe 6 months ago. And so still a lot of work to be done, but off to a good start. Next slide, please. Strengthen staff capacity for cultural safety. The purpose is to focus on individual level interventions to address staff knowledge, attitudes, and behaviors that contribute to systemic racism in the system. And the function is to support and build capacity of staff on their learning journey. So the actions, the big action here is that we do deliver monthly 2-day in-person cultural safety and anti-racism training. I'll get into that a little bit later in the presentation. We're in the final stages of drafting a cultural safety and anti-racism training framework, which will be released to the public. We're hoping in the fall. So this will really like outline our training approach and how we developed the framework. We've committed to establishing a learning center where our staff will develop in-house resources and tools around anti-racism, bias, self-reflection, systemic racism learning for staff across the system. It will probably just be a website or something. Next slide, please. Honor Indigenous knowledge and wellness in care. The purpose is to focus on policy and program development of Indigenous knowledge and wellness within health and social services. And the function is to increase the awareness of and availability and access to Indigenous knowledge and wellness within the system. So we have one position dedicated to this work, and we just hired this individual. So this work involves providing secretariat support to that Indigenous advisory body, the body that meets 4 times a year. Our work is also presented to the Indigenous advisory body every time they meet. So they're a sounding board. They let us know if we're on the right track or if we need to make improvements to our approach. Additional actions include hosting a gathering of knowledge holders. Due to COVID, of course, this hasn't been possible. So we're just waiting for some additional direction from the Indigenous advisory body on when to proceed on that, as well as doing some environmental scans. I have to look at my notes for this one. My apologies. All right, on existing traditional practices and services in the Northwest Territories, including a review of best practices in other jurisdictions, and produce a report and findings, including gaps, challenges, and opportunities. I didn't mention on the timeline slide that we have gone on learning tours, and one of the most, I don't know, epic tour that we went on was in Alaska, in Anchorage, to see South Central Foundation. That's like the amazing healthcare system designed by and for Indigenous people. And so we've taken so many learnings from that experience and hoping to also embed that across the system. Next slide. So improve client and community experience. The purpose is to ensure that Indigenous patients have clear pathways to provide feedback and inform system of complaints and improvements. The function is to establish structures and processes for accountability and to monitor changes to address systemic racism and improve cultural safety and patient experiences. So this is an area that we haven't had, that we haven't focused on too much until recently. So we've established 4 Indigenous patient advocate positions in the 4 acute hospital settings in the Northwest Territories. And these Indigenous patient advocates are there for Indigenous patients to help with system navigation, to help with Indigenous or cultural needs, whether an Indigenous patient needs or would like a ceremony, would like someone to speak to them in their own language. Remember, we have 9 official Indigenous languages in our region. Also, if they have any complaints that need to be resolved. So connected to the Indigenous patient advocates is a new pilot that we are getting off the ground soon, probably in the next couple of months, is the Office of Indigenous Client Experience. So any of those issues that can't be resolved on the ground will be elevated to this office. And we're anticipating that a lot of those racism complaints will come to this table. And so at that table, we will have elders and experts to analyze the situation and provide advice and recommendations for how to proceed. And then clients' rights and responsibilities is another action that we're working on, just to ensure that patients and clients know what their rights are in the system and how to advocate for that. Next slide, please. So a little bit of a deeper dive into the training program. Okay, great. So this quote comes from one of the Truth and Reconciliation Commission reports, which we call the TRC in Canada. And this is a commission that was, the mandate was to educate Canadians on the Indian residential school system, to bridge that gap between Canadians and Indigenous people. And I like this quote because it highlights the importance of education and the role it has in combating systemic racism. So much of the current state of troubled relations between Indigenous and non-Indigenous Canadians is attributable to educational institutions and what they have taught or failed to teach over many generations. Despite this history, or perhaps more correctly, because of its potential, the Truth and Reconciliation Commission believes that education is also the key to reconciliation. Education must remedy the gaps in historical knowledge that perpetuate ignorance and racism. Next slide. So the training aim is to ensure that all staff working within our system have the foundational knowledge, skills, and self-awareness to address anti-Indigenous racism and facilitate cultural safety. This training will provide staff with a common language and basis to understand the root causes of systemic racism and to identify actions required at individual and organizational levels to dismantle it. And this picture is of one of the training sessions. We often have it sort of outside of town, not always outside. This was last July with the Northwest Territories Medical Residency Program that started a couple years ago. We have 2 medical residents every year that come together. And so we bring them and their preceptors and other physicians together to deliver the training. And this is actually my mom, doing a teaching. Next slide. Okay. So the training format and delivery, of course, I mentioned it's a 2 days in-person training. Sometimes we have it on the land, but in the Northwest Territories, it's pretty much winter from like October till April. So it gets pretty cold out there. We take a transformative educational approach by embracing and normalizing discomfort as necessary for change. The curriculum is an approach is 100% Indigenous designed and led. I think I forgot to mention in my intro that I first learned about cultural safety as an undergraduate student in 2005. And so when I counted the years, of doing my undergrad and then my master's, which I also focused on cultural safety, and then the work that I've been doing, it's like almost 20 years. So it's like, when did I get that old? So yeah, so a lot of this work is grounded in the work that I've done, and then as well as my Indigenous team. The other piece that's really important to mention is prioritizing spiritual, emotional, physical and mental well-being for everyone. Really can't stress this enough. As an Indigenous team that is essentially at the front lines of this work, we're exposing ourselves to, white fragility, folks who aren't ready to tackle this material. So we really have to ensure there are mechanisms in place to take care of ourselves, and that includes we're always debriefing. We have counselors on site. We also commit to like a wellness activity following the training. So that looks differently for everyone. But for me, feeling physically good is important to me. And at the end of each day of the training, I'm absolutely exhausted and mentally drained. And so I just essentially go home and I go to bed. So the day after the training, I'll spend an hour after getting up and just having a good workout, and then I'll show up to work. So that's really important for the training team. For the learners as well, we do have Indigenous staff who attend the training. And so their well-being is of the utmost importance as well. Most of us as Indigenous people have someone in our lives who has gone to residential schools or we're impacted by racism every day. And so folks who are Indigenous who come to the training have access to an Indigenous counselor. They decide when they want to come to the training, and we also deliver an Indigenous only session. We also have Indigenous guest speakers who also need to be taken care of and making sure that they are well and want to do this work. We just have to acknowledge that it's a gift that we're giving non-Indigenous people to hear about other people's trauma. And this tends to be what staff, non-Indigenous staff, like the most. They love to hear the stories. They love to hear the teachings from Indigenous guest speakers, but we're very mindful that it can be triggering for the Indigenous guest speakers. So we seek out folks who are passionate about talking about their own experiences. And we also compensate them by paying them a prep day, and of course for their time, and then a recovery day to take care of themselves. We also give all participants a wellness bag. So similar to the gift bag that we received here, it's full of wellness items for everyone to take care of themselves in the evening. Okay, next slide. So just some lessons learned, and this picture is from Denendeh, which is the community that my mom and my grandparents are from. So I already highlighted this, but anti-racism must be highlighted in the cultural safety work. And so if you're using the language of cultural safety, it really just helps to clarify that the aim of cultural safety is really to address systemic racism, and that the focus is not just on adding on Indigenous culture and practices, that we're really trying to address that as well. We found that across the system, there is inconsistent use and understanding of terminology around cultural safety and all the different cultural terms. And so I'd really suggest and recommend that if you're looking to embed an approach, that you're really focusing on that education of what terminology you're using and what it means, so that everyone is on the same page. I also highlighted prioritizing well-being of Indigenous staff for sustainability. I have an amazing Indigenous team, and we work for the government, so there are a lot of rigid rules around how that environment works. And so it's learning how to be flexible within those rules, and really, as a manager, reflecting on how I respond to my staff's needs and wishes, and trying to interrupt my own, biases around things. So really trying to support my staff. If they need a sick day, absolutely, you're doing really hard work that no one else is doing for the system. So really making sure that staff are being taken care of. And then finally, lead transformative change while showing the same kind of respect cultural safety strives to achieve. So this is the approach that we try to take, is a balanced one. It's challenging, of course. There's different approaches that are really hard and, straight to the point, and that's what we try to do. But we also try to balance it with an approach that's basically like, we don't want to turn people off. If the intent is to have engaging conversations that historically have not happened, then it's sort of, how do we have that conversation without completely turning people off? So it's definitely a challenging stance to be in, but this is the one that we take as a team, and something that we reflect on in terms of our grandparents and how our grandparents taught us to be respectful. And I think that's it. Yeah, Masicho, thank you so much.
Ask for care in their language. I live in a community where we have 3 tribes, 3 languages. We all basically speak the same language with a different dialect. we can pretty much understand each other, 90%. In your case, is it similar? And do you guys speak multiple languages? Or is there a common indigenous language?
Can you go back to the map slide, please? So there are some regions that have similar languages, but they all group together. So in my region, there are a couple of dialects that I think are similar. I actually don't speak my language. I didn't share this, but my mother, so she went to residential school and I was raised by my non-Indigenous father and family. And so, well, my mother is still a big part of my life. She had to go on her healing journey. So I'm still learning as an Indigenous person, my own history and culture. But what I can share is some of the dialects are similar, but some are not. So what's happening up here, the Inuit people have very different language from the folks down here in the South. And not all, there are some services like the Yellowknife Hospital that provides Indigenous languages, but that might be one of the only places. Maybe there's a couple places up north around the Inuvik area. But yeah, we're not quite there yet, but that's one of our goals, is to be able to provide services in all the different languages. It's just sometimes it can be challenging because we are a bureaucracy as well. So trying to get through the policies. Yeah. I don't know if that answered your question. Okay, thank you. Yes. Yeah. Oh my goodness. So this is one of the, I had a briefing with the new deputy minister last week, and one of the weaknesses of our work is that we don't really publish anywhere, and that we're with a team of 6, we're just at capacity all the time. You know, we have this whole system coming at us all the time. Can you do this? Can you do that? So really eager, but we just don't have the capacity. So to answer your question, we do have a website, but it's kind of outdated. But that is something that we're working on. Like I mentioned, we're going to work on a learning center. We're working on releasing a framework for the training, but I'll give you my contact information and you can get in touch with me for sure. Thank you.
Being an non-Indigenous person working in this space, it really sparked my interest in trying to gather as much knowledge as I could. A lot of information really comes out of that. So looking at a lot of the publishing that they published out of New Zealand really helped me understanding the difference in cultural competence and cultural safety, and how never be confident in someone else's culture, but cultural safety really kind of shifts that power balance to where those individuals have power over their fear versus. So that was one of the things that helped me out for sure.
Yeah, absolutely. New Zealand, Australia, Canada probably will have done the most work around cultural safety as a concept. Yes. Say that again, please. What is it? Like, what does it look like? Yeah, that's a really good question. So we really are trying to educate, our staff around what does it mean? What is systemic racism? And it's really focused on how the system perpetuates inequities, and looking at the outcomes of systemic racism would be that there is an overrepresentation of white people working in our system, for example, and an underrepresentation of Indigenous folks. It's just sort of like, I had some good examples in my presentation last week. Getting all of these requests from across the system that don't acknowledge that part of the reason why we have Indigenous health disparities is because of residential school, colonization, racism. So this lack of awareness or acknowledgement that exists. Systemic racism also, an example is when a system privileges Western knowledge over Indigenous knowledge, as well as just this Western approach just embedded in the way that we do things and policies and practices. It's a tricky one to answer. Yeah. But we're working on it. And that's another thing. It's being able to confidently speak and provide examples about what we mean when we use this different terminology. Any other questions? I didn't leave my email on my slides, so I'm just wondering if you would like, I can give you my email address after we're done here. Yes.
Staff wellness and experiencing discomfort might sometimes feel like being re-traumatized.
Yeah. Absolutely. Yeah, I don't know. Yeah, I know what you're talking about. One of the activities that we do in our training is a sharing circle. And so that will be our Indigenous staff with non-Indigenous staff. And yeah, it's really tricky because you're there watching people unpack racism. And so that can be really triggering. So again, it's about ensuring there are supports for the staff, debriefing all the time, being really open to whether a staff needs some time off, learning opportunities. It's really new field. So I feel like we're learning as we go, but also in our job descriptions, we outline that we are at the front lines of work. So they are prepared when they come into the job, that this is what's expected of them. Yeah. Yes.
It's really the two, I like the cultural safety and anti-racism. Is there anything built in, or I guess a purpose why anti-racism and not anti-discrimination? If you tie in anything with gender or sexual orientation with culture, just because
Right.
I know different areas have different experiences with,
Yeah.
two spirits.
Yeah.
things like that.
Yeah. So again, still new and really exploring what this work will look like. So yes, absolutely. We are aware of that. And I imagine moving forward, that's something that we'll definitely have to consider are the different experiences across, oppressed groups. So I'm still working on that piece. Thank you. Yes.
Our medical system, we constantly try to reach out and do exactly what we're doing. Really share our culture and how important it is, because that's part of what the service is as we're what are some of the barriers that you find from the medical system itself? Because we run into so many different things. We're constantly if there's new leadership, we have to go back and constantly educate.
Right.
We have to educate at the state level. We have to educate at the federal level. FEMA that came in, we had to educate the federal level in front of the state level so that the state can understand that this is how we're speaking.
Oh.
This is how so what are some of the barriers?
Oh, I think our context really supports this work because again, we live in a territory that's 50% Indigenous. And so our members of parliament, I'm not sure how many are Indigenous, but there are many Indigenous folks who are always advocating for this work to be done. And so it's gotten to the point where like the non-Indigenous people in government can't deny it anymore. Like there has to be action. And so up until 2013, it's just been slowly building. So I think the context has really helped us move forward in this work. Barriers, like just as much as like we've had champion leaders, sometimes we have folks in senior management positions who just don't get it. So I would say those are our major barriers, are just the ones who just might not necessarily get what we're doing or misinterpret it as, you know, they're all Indigenous staff, so all they do is just Indigenous cultural stuff, right? Like we're doing so much more than that. We're doing work that's never been done before. So I think just the context for us is just so different that it's really enabled all of this work to take place. So I guess I feel at this point we have so much support, but there are still, you know, the stats that I gave, like there are only 22% Indigenous people in senior management and 8% at the authority level working in senior management. So I think there's lots of different factors at play. Yeah. Any other questions? Thank you so much. This was a real honor to come all this way. It took me like 2 days to get here. And I was rushing through customs in Toronto yesterday. And honestly, like I was getting the text that the flight was boarding. There were like 100 people in front of me and I made it. And then we sat on the tarmac for an hour because there were no ground crews. So I'm here and I'm so happy to be here. Yeah, Masicho. Thank you for the opportunity.
Thank you, Ms. Hall, for that wonderful presentation and appreciation. You said would like to gift you with a gift, so we will be getting that over to you shortly. And then we also do have some session-specific evaluations that I'm going to be passing out. If you could please complete those and return them to the registration desk, that would be wonderful. And thank you, everyone, for joining us today.